guys, it's Andrew. It's nearly Christmas time. I'm wearing my Rudolph antlers to make me look pretty. I need a lot of help. Are you feeling sad today? That's a strange question. And it's a little play on words because SAD stands for Spinal, Arthritic and Disc Disease. So our poster says here, are you feeling sad? And it's kind of just saying, like, if your neck's in a bad way, it's going to make you feel pretty crappy. Very, very common symptoms of fatigue, headaches, sometimes dizziness, sometimes poor balance. But your neck is the most important. We talk about a lot of this. How important it is that it's literally so close to the brain. It's a weak structure, doesn't have a big rib cage around it. And also it has a huge amount of neural receptors in the top part of the neck feeding back to the brain. So your brain needs that charge from the neck, but the neck can get beaten, abused from birth trauma, from learning to walk, from falls, from whiplashes, from stresses, from sitting behind the computer, and our neck changes from a nice beautiful curve. So I use the analogy that our head sits on, that's our head, and it sits on this beautiful curve here. So that's the curve, around a 40-degree curve. It should have this bounce of it because gravity is pushing down on the top, and we have this beautiful curve here. So our neck is there, and our head should be upright against gravity. Now, with time, with stresses, any type of stress, whether it's eating and going on a stag do and drinking loads of booze and having kebabs every night for a week, which I'm sure all of you do all the time, that's a stressor. Then you go through a breakup, then you have a little, then you go through a whiplash, and then the whole neck, the stress of that system, totally changes. So you're going from a beautiful curve like that, sitting there, to something going forward. And you can imagine the stress on the soft tissues, the ligaments, tendons here, the discs get squashed. And over time, that becomes a SAD spine, arthritic spine. So we've got a beautiful curve here. You start losing the curve, level 1. Then arthritis starts settling in. The discs, you might not see it so much, but the discs start to narrow. They lose their hydration. Now, discs get fed not by blood supply, by a process called imbibition, like a sponge, water being squeezed in and out of it. The discs have to move beautifully, and that area has to move beautifully for the discs to be healthy. This is very important for allowing those nerves to exit. So we are on level 2 here, loss of curve, arthritis is beginning the discs. Level 3, you can see those vertebrae really changing shape, spurs, arthritic changes, and what's happening to the spinal cord back there. So it should be like this. The spinal cord, research shows it gets stretched, the nerves get trapped. And one of the first presentations is loss of this movement of that neck, lateral flexion, which we don't often change, we don't often check ourselves. And then you can check yourself. Can you balance one leg with your leg at 90 degrees for 30 seconds? You're able to do that, no problem, both sides. That's another way. We should all be able to do it, doesn't matter your age. And then we progress to level 4, which is fused vertebra, very arthritic. And by that stage, it's very, very common to get something called cervical spondylitic myelopathy, which is basically the spinal cord getting compressed, and that leads to bladder and bowel control issues, balance issues, just a poor quality of life long term. So look after your neck. We talk about it all the time. So the neck is so, so important. So you want a beautiful curve, beautiful posture, get your core working strong, and that's so important. So I hope that makes a bit of sense. Thank you guys.